Good morning, everyone. My name is Mary Brosnan. I'm the Director of Midwifery and Nursing in the National Maternity Hospital. Happy International Midwives Day and Happy International Nurses Day. I'm thrilled to have been asked to speak by Susan Kent, who's an old friend of mine, and we are presenting today about glocalisation in nursing and also in midwifery, and I'm thrilled to be asked to present my views on that subject. So I'm going to start sharing my screen now. So moving on, I only have 20 minutes, so I'm going to be very quick with my few slides here. I'm going to start by telling you a little bit about myself and then talking a little bit about midwifery generally across the world, a little bit about the Irish context, and a little bit about what we're doing in the National Maternity Hospital in terms of research, and thoughts about the future direction of midwifery as I see it in the next couple of years in Ireland. I'm in midwifery a long time, and I love this picture because it says, if I knew then what I know now, starting out in my career, I might have done certain things slightly differently as an earlier director of midwifery, but you live and learn, and I'm very glad to share my experiences of where we're moving towards in terms of midwifery in Ireland and in Dublin and in our own hospital, naturally enough. I love this old slide because it shows you where we've come from in a sense. And this is a picture of the rules for probationers that was written by one of my predecessors, matron Rose Sheridan, in the 50s. And it just shows you what student midwives' lives were like in the 50s in Holles Street. And it's quite funny, really, when you read some of the things about being in bed at a certain time and how to behave and work with decorum, etc. And I love that no ink or fountain pens be used in the bedroom. Thankfully, we've moved on a lot from there, but it's just a bit of a reflection, a bit of humor for today, the day that's in it. Most of people would have heard of the National Maternity Hospital, but just to share a little bit about what we're at the moment, I suppose it's 8,000 births more a year. A lot of operations in terms of gynae facility. 1 in 12 citizens, babies are born in this country. Over 1,000 staff. We're a national referral centre for lots of different specialties, and we're part of the Ireland East group. I suppose I was really fortunate in my career in the last couple of years to be selected as a scholar for the Florence Nightingale Foundation. And it was really a life-changing experience for me as a midwife. I was the first Irish scholar, and I owe a great debt of gratitude to the Centre for Leadership in the HSE, who sponsored me, in addition to the National Maternity Hospital funding some of the scholarship. But in essence, it's a leadership scholarship where I met incredible people in the UK and further afield, and indeed some of my own Irish colleagues. And it was a really wonderful opportunity. So part of that, I suppose one of the things I learned about Florence is a huge amount of her work over the years was about data and about showing the value of nursing contribution in terms of managing data and producing that data to inform practice. And I suppose that's something, her huge legacy in terms of all of her writings are around using data to support clinical practice and changes in practice. Today we're celebrating the International Day of the Midwife, and this picture here is from the ICN website, and it's showing what the motto for this year's International Day is, and it's about investing in midwife. And yet again, it's talking at the bottom there about following the data and investing in midwives. And I think that is showing the value of investing in good maternal health across the world, and particularly this is referring to the Global South, and talking about the sustainable goals. And again, a huge amount of data is collected by the ICM in terms of preparing world reports. These two refer to 2014 and 2017, the state of the world's midwifery. And I thought by today we might have been able to talk about 2021 report, but it isn't actually reported on yet. But I have a few summary points that I'm going to make for what we're expecting to see in the 2021 report, which I'll show you here. So on the left of the slide, you can see the main things they're going to be talking about in the 2021 report is the availability, accessibility, acceptability, and quality of midwifery workforce. And that again is never more pertinent than in the middle of a global pandemic. It's talking about equity and support and opportunity for midwives wherever they work, whether it's in the global south or in the first world. And it's really talking about the impact of midwives, looking at the impact of survival rates for women and babies, looking at the impact on health and well-being. And a huge part is looking at the rate of return on investment. We're a very, very economical workforce. And I think all of us who work in maternity would know that the value of midwives in terms of the investment and return is proven. But as I might mention at the end, we're not always able to produce the evidence to show our worth. I've just put a small point here on the other side of the slide on the right here about the impact of the baby bust. And unfortunately, there is a worldwide decline in fertility rates. They're saying now from all the international evidence that there's a 50% decline over the last 50 years, which will have a huge impact on future population growth. And where that population is growing and where it's falling is a very interesting phenomenon. If you look at now, Italy, South Korea and Japan have really lower populations. And they say there will be a 50% drop in those particular populations before the end of this century. And there's a lot of debate in the literature about why infertility rates are so increased. But there is a lot of evidence coming out now about the environmental factors. And that again is looking at the whole impact of globalization and how toxins, etc., are impacting on our work, our living environments. And again, there's a whole debate there about the geographical disparity and inequities across the world. And yet again, referring to the global pandemic, that's never more apparent than it is at the moment. In Ireland, we're lucky to have a National Maternity Strategy. It was written in 2015, it was published in 2016, and I was lucky to be part of the group that developed that, multidisciplinary group that developed that strategy and presented it to the Minister for Health in 2016, who was Liv Radker at the time. And you can see there the vision is that we'd have safe, accessible, high quality services across the country, not just geographically based or dependent on where you live, and that they would be provided with dignity. The services would be provided with dignity, respect and compassion, and that people are supported for choice. There is no doubt that there are a lot of challenges for all of us at the moment. I'm looking there, I'm not going to go through them all, but you can see that across the board, women's expectations are rising, rightly, but it also is impacted by what's possible in the Irish context at the moment. And we do know that there's an illusion that everything will be perfect, and that's portrayed sometimes in the media, where you see the Hello magazine presentation of the perfect woman with a perfect baby and the perfect body afterwards. And we know that's not always the reality for a lot of women. Rising complexity is an issue, staff retention is an issue. And unfortunately, we're working in a very litigious climate, and we know that there's challenges for funding. And then there has been COVID. Again, we've had lots of discussion already about the impact of COVID today, so I'm not going to go through it, except to say that it has been one of the most challenging years in my lifetime so far as a midwife. I've been working almost 30 years in midwifery, and it has been the most unusual year of all of our careers, I would imagine. And it is important to look forward, because there is a World Future Society, and if you Google this group, they're very interesting, looking at how life will be after 2100 sounds like a long way away. But the children who are born today will be probably 100 in 88 years' time. They will be well over 100, and that's in global terms, that's a very short time away. And we need to look at what it is we're going to be presenting today's child born in Holles Street today, how their lives will be in the next 100 years. We're doing a lot within our hospital to try and normalise birth. And the picture on the left there shows one of our registrars, Teresa, doing a ward round in the antenatal ward with all the curtains pulled, all the equipment in the middle of the corridor there, 14 beds in that ward. There's all sorts of equipment, as you can see, blocking the route there. But in that context, we haven't got the spades in the ground to build our new maternity hospital yet, and we are still working towards that and our move to St. Vincent's. So in the meantime, we have a lot to do to try and return our at least maintain our focus on normality and look at what we can do. And a huge emphasis on bringing things back to normal has been with our community midwives and midwifery service, looking at introduction of the labour hopscotch, introduction of hydrotherapy, which has just been launched, telemetry so that we can monitor fetal hearts remotely. All of that is in an effort to try and maintain normality. I suppose I like this slide because it shows the elephant there saying, sometimes I'm standing in the middle of the room and no one acknowledges me. There are lots of reasons why things are not moving as quickly as we'd like. Some of it's to do with culture, some of it's to do with private practice, some of it's to do with funding, and some of it's to do with infrastructure. So there are lots of reasons why we are not all working in the most perfect service. But I'm proud to say we're working and striving towards moving things to that perfect service. And when I'm frustrated and irritated with the lack of progress, I think about perspective at times. And I love this slide because it shows the perspective from the island and the boat and how things look from a different perspective. But I had a very, very real example of that when I had the opportunity to go to Malawi a few years ago with the Rose Project. And this was what I saw in what they considered to be a new labour ward in Malawi. On the left, you'll see their resuscitaire, which was a bedside locker with a lamp hanging over it. And that's where the babies were resuscitated. And on the right-hand side was their new labour ward. And they were delighted with this room. And it had no cotton sheets on the bed or no draw sheets. It was just plastic sheets and buckets on the ground. It was a rude awakening for me. So when I talk about frustration with our services, I reflect back to that sometimes. And I think really we have a lot to be grateful for in the investment we are receiving in our services. So just going back to our topic about globalization, I suppose one of the things we're really not great at is showing the evidence of how good we are how good value we are for money. A very important part of our discussions around providing a service is around staff well-being. And happy staff mean a happy service and happy women, really. And ultimately, our staff well-being is directly related to employee contribution, motivation and outcomes for women. And we know that investing in staff is a direct investment in care. Unfortunately, there's a huge amount in the literature about the fact that midwives across Europe, and this is UK-based midwifery research from a couple of years ago, looking at job satisfaction. And unfortunately, if you look at all of the professions, midwifery did not fare very well when it was looking at this very large ICM study or RCM study. A lot of people feeling very stressed and burnt out, and a lot of people declaring that they may well look for other jobs. And this was before the global pandemic. So on a positive note, there's a huge amount happening in the world of midwifery research in the National Maternity Hospital and UCD and the Ireland East group. So I want to just here acknowledge Michelle Butler, who was a colleague of ours in UCD at the time of the establishment of the joint research network with the Ireland East and NMH at the time. In 2007, when I recently enough had started my job and Michelle was head of school in UCD, she suggested that we start this research network, and it has grown from strength to strength. Michelle, and since then taken over by Denise O'Brien, Barbara Coughlin, and all the team, Lorraine, Carol, I'm afraid to forget somebody. But equally, all of those midwives in UCD have helped us sustain this research network, and it has grown from strength to strength. And I've listed some of the studies that we've done there: the evaluation of the labour hopscotch, perineal management study, bereavement, and more recently, the postnatal morbidity service that has been evaluated in the National Maternity Hospital. And it's all very important to set up new services, but it's even more important to evaluate them and to get that research published. So these reports have been issued over the last few years, and we are now in the process of trying to get various papers into peer-reviewed journals so that we can disseminate that information and prove the value of investing in midwives. But I do want to mention Michelle specifically, and you're so lucky to have her in DCU. Midwifery can be a very, very difficult environment. There's no point in saying otherwise at times. And I just want to talk about litigation. And there is a fair amount of concern about the amount of litigation in the service. Obstetrics as a discipline accounts for 60% of all the claims paid out in the state claims agency. And so midwives and doctors are working in a very litigious the context is quite litigious at times. So we really try and support midwives to make the best judgments they can in terms of providing care to women with a no blame culture. And there is unfortunately a lot of knock-on effects of something going wrong in maternity if they impact primarily on the family, but you also have a second victim in the staff that are involved. So we spend a lot of time supporting staff in terms of providing the support they need if there's an investigation into an adverse event. I sometimes wonder, how do we all survive in this world? And I suppose looking back over what has been the case over the last few years, and particularly from my years as Director of Midwifery, I suppose what's keeping us going is that we control the things we can control and look at what it is we're doing and believe in what we're doing and look after ourselves. I talk a lot about this at work, about managing ourselves and being true to what it is we need ourselves and using our authority and responsibility responsibly, and doing a lot to affirm staff, affirm what we do and try and promote, I suppose, autonomy at every level. And at the end of that, I have who's holding the holder. I think really it's so important as senior midwives to look after our own needs as well and to be really conscious of self-care. And that's something that I really strongly believe in. And reflecting on my last couple of slides here, reflecting on my own leadership, I think keeping focused on what we're doing is so important, and keeping grounded in the whole philosophy of normality is something that keeps me going. A huge amount of what I believe in is using humor at work as well to maintain the sense of our perspective and our sense of values for our own midwives and ourselves. And again, having a future focus, so constantly looking ahead, seeing what it is we can do for the service to improve it, looking to try and, for instance, introducing hydrotherapy in the hospital this year has been a huge boost to the midwives to allow women to use water as pain mechanism. We've had a huge investment in our labour ward, so we've 12 lovely ensuite rooms, and hopefully we can introduce more water as part of that. And having the courage of our convictions. I suppose a lot of midwifery is about our heart, and using our heart and our head kind of does keep us focused on what it is we're trying to do. Keeping optimistic, but I keep saying avoid terminal niceness. I love that term because it was used to me one time when we were talking about what it is we do to manage staff and how we can allow staff to, and when I use the term terminal niceness, I mean allowing staff to have a rant when they need to, and that it's not all just about maintaining face. I think it's about using all of our support structures to allow midwives to practice as midwives and to be autonomous, and also to recognize when we're having a difficult day. Focus on the enablers and ignore the invalidators. I think that's one of the things I spend a lot of my focus on, is look at the people around me who can help change happen and try and just not necessarily always ignore the invalidators, but work around people who are just blocking change. And I'm a very strong believer in seeing the good in people. I think that's what's kept me sane and positive despite 15 years in this role. And I think we have to recognize that things change and be prepared to respond to that change. And yet again, referring to the pandemic, have we ever been more aware of the fact that things change outside of our control and we have to react responsibly and proactively to that change? So the last slide here is a little bit smaller, so I have to put my glasses on, apologies. Looking at the future focus, well, there's no doubt that the maternity services have had a huge investment in the last couple of years, and that we're expanding choice across the hospital and community services. And that's something we continue to do. Today, we're just opening a new clinic in Blackrock, which is really a lovely thing to do, where we have another choice for women to have their care outside of the hospital in a lovely antenatal setting, which is something we're continuing to try to do. All hospitals probably have seen a big change in their digital platforms. We've had a huge embracing of digital health for particularly specialties like diabetes. We've 780 diabetics, I think the last count, who are receiving care for gestational diabetes. And Attend Anywhere is a new platform that the HSE have invested in that has given us an enormous boost in terms of being able to do that. I mentioned research, but I think we have to keep our focus on research despite the day-to-day challenges we have. We're doing a lot to expand our research into the other Ireland East hospitals, Mullingar, Kilkenny and Wexford. And our particular emphasis is in looking at postnatal care at the moment and improving that element of our service, and looking at the care of women with hyperemesis is a particular focus this month. I'm talking about students in terms of their care, their placements. I feel the students have had a really raw deal in the last year. They've really been, their placements were truncated at times, but they are our future workforce, and we really try and bring them into the fold and make sure they feel part of the workforce, and that they feel their experience is supported and valued as much as we possibly can. A huge area of development will be AMP and ANP roles, and they are being invested in. Career progression and succession planning is ever more important. And I mean, as we look to all of us who are in our later stages of our career, perhaps, we need to be looking at the midwives who are coming behind us and what it is they want to do, how they can be supported in terms of producing midwives of the future. And that's, I think, we owe that to the midwives themselves and to the women who are in our care, that we are looking to invest in the future midwives to ensure that they are fit to take on these roles. And they may do them very differently in the future, but we need to prepare our junior and middle grade midwives to take on those roles. And I can't finish without mentioning our move to St. Vincent's. It's a very, very exciting opportunity for us to move to a new campus with all purpose-built facility, 3 times the size of this current small infrastructure in the National Maternity Hospital on Holles Street. So we'll be moving towards a beautiful campus in St. Vincent's, and I hope that'll be built in probably 5 years' time. And that is a huge focus of our time at the moment to do that. So on that note, I'm going to stop talking. I will be available for the panel later, so I'd be so delighted to take questions from anybody. We are delivering the future. We're thrilled to be part of that. I suppose the privilege and the ongoing work that we're doing to make sure that women and babies are born safely in the hospital, in the community, in the most appropriate place. And I suppose it's an honour for me to share my thoughts with you today. Thank you so much.